He really wants to be independent, but at the same time, I think he knows that he really can't be. He doesn't turn on the stove and try to cook anything, thank goodness.
When I didn't realize what he had, I was very impatient and quick-tempered about him not remembering.
It was really hard to see him hit his head on the side and say, think, 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 because he was trying to do things, and that's upsetting when you know that they want something, they can't do it.
So many families feel guilt, whether it's a child, an adult child who promises to take care of their parents, whether it's the spouse who has been with their loved one for a lifetime.
It's okay to remember the past, but it almost becomes an obsession with him that he thinks he doesn't have anybody.
I said to my brother, you need to go see Ted, and he said, it's scary. And I said, yes, it is very scary. But what are we going to do? Does that mean that we walk away from things and not do anything?
Alzheimer's disease is the most boring disease that you can have. It is a boring disease because the things that you normally are used to doing now are difficult or perhaps impossible.
They've promised their loved one that they would always take care of them. And now that they're in a situation where they simply can't do that anymore. So we use Give Respite a Try as an introduction.
It's really hard because the personality changes every few minutes or 10 minutes or whatever. And I think it just plays on your emotions so high that you can't handle it. And it's really hard because of that.
Sometimes I feel guilty when I get out of, when I start seeing my patients going. I have to fight that sometimes, not to say I've told you that 1,000 times, but so I just have to lay back and just repeat it and not raise my voice.
Many people come to the association in a state of crisis, and they don't know what options are available to them.
First, I thought it was like you were just trying to dump somebody off on people that are out there willing to take care of a person.
My niece wanted us to go live with her, and then all of a sudden she said, I can't live with Uncle Ted. That became very difficult for me too.
Often the caregiver is suffering from stress, from ill health, and it's reached a point where the caregiver just doesn't know where to turn, doesn't know what to do next.
Respite care is important both for the best care for the patient and also for the caregivers.
To have to rely on somebody to take over some of the things that you think you should be responsible for, it causes a lot of guilt. It causes a lot of guilt.
Those family members will understand that they're not betraying the trust of their loved one. What they're doing is for the loved one's benefit as well as their own benefit as a caregiver.
Caregivers need to have rest themselves so they can come back and be invigorated.
It gives me some time to be by myself and to think of what my burdens are and what the good things that I've got going.
It gave me a day where I had my day. I knew that he was being taken care of, and I look forward to those days. They came once a week. They fixed his food.
It gives me an opportunity for me to mingle with other people on an adult level instead of trying to constantly think of how you're going to answer your loved one.
People with Alzheimer's disease need to have activities, they need to be kept stimulated, and having a caregiver who is enthusiastic and energetic too is a big help.
Respite is really an opportunity for a caregiver to enjoy life, to place their loved one in the care of a skilled individual, or participate in daycare with skilled individuals and with other persons who have Alzheimer's disease.
Adult daycare activities, which is one form of respite as well, can be very valuable to patients because they have that social interaction. If it's just the spouse or just the daughter that you're interacting with, you don't have that whole breadth of interactions that can happen when you're around other people. And in adult daycare situations, there can be other people who are like you, who also have memory problems, so it isn't so embarrassing.
I really do see it as a useful tool for us to use as a family, and especially me.
I just think it's really important for people to reach out and to care for people when they're going through this, because everybody needs it.
It's been a real help to me to give me some time to think for myself and about myself, because I get lost in the shuffle.
I just appreciate every heartfelt that they do for us and my family.
This gives new meaning to people's lives who might otherwise be housebound.
Even the caregivers need to know that they're loved.